Hello, let's talk about the history taking steps. History taking steps. So, while taking the history from the patient, first step is to introduce yourself. Okay, so the first step is introduction. Introduction of yourself and from the patient and greeting. Okay, so this is the first step in the history taking. Then the next step is to ask about the presenting complaint. Okay, ask about the presenting complaint. And while taking history, you must show the empathy to the patient. Okay, so in every step where needed, you must show the empathy. Okay, then after asking about the presenting complaint, then you have to ask about the details of this presenting complaint in the history of presenting illness. Okay, history of presenting illness. Okay, this is actually the details of this presenting complaint. Then the fourth step is to ask about or inquire about the differential diagnosis. Okay, ask the question about the differential diagnosis. Then the fifth step is to ask about, after differential diagnosis, ask about the past medical and surgical history. Okay, if the patient is seeing his or her GP for any condition or not. Okay, so this is the past medical and surgical history. Then the after the past medical and surgical, you have to ask about the medication history, if the patient is taking any regular medications or not. Okay, so ask about the medication history. Then after the medication history, you have to ask for allergic history to anything. Allergic history. Then ask about, after the allergic, ask about the personal history and the social history. Ask about the patient about his or her occupation, and his the personal questions like the is he smokers or alcoholics. Okay, so ask about the personal and social history. Then the ninth component is the to ask about, and it is the last and most important step, to ask about the ice component of the history. Ice component mean, I mean ideas. Okay, then C mean, okay, C mean concerns. Ask about the concerns of the patient. And the last is expectation of the patient. Expectation. Okay, so these are the steps of the history taking: introduction and greeting, then the presenting complaint, history of presenting illness, differential diagnosis, past medical and surgical history, medication, allergic history, personal history, and the ice component of the history.